thought is essentially something that occurs in the mind, and an important principle of mental health is you are not your thoughts. The thoughts may be there, but you don't necessarily have to give them any attention or validity. In fact, you can separate yourself from the thought, and this is what mindfulness-based practices teach. Mindfulness practices are often shown to help with both medical and psychiatric conditions, and it's basically this notion that whatever thought, feeling, sensation you have, just to be aware of it and cognizant of it, but don't necessarily give it any attention or validity. Just let it go through like one ear out the other, or just let the sensations sort of flow through your body. So if there is something that your mind is telling you to do something, you don't necessarily have to obey or follow it. You can question it, you can challenge it, you can ignore it, you can distract yourself from your thoughts. There are some thoughts that mental health professionals tend to see quite often, including thoughts such as magnifying the negative and minimizing the positive. Maybe it's ignoring the good that's happening. Maybe it's just being so fixed on one perspective of the situation and not seeing it in other ways. So these cognitive distortions I've talked about in previous videos, but those are often what mental health clinicians like therapists, psychologists, even psychiatrists will try to address and change, because with that change will come a lot of help in treating any of the underlying mental health or even physical symptoms one may be experiencing. So it all has to do with this relationship that one's thoughts affects their feelings, which affects their actions. And all those things are related. So if you change just any one of those three, then the others could change as well. Also, it's part of this notion of the cognitive triad, which is how you view the world, how you view yourself, or how you view other people is going to affect your thoughts, your feelings, your actions. And so just changing those or being cognizant of those things can help to improve mental health. In fact, it's thought that having a negative viewpoint of any of those factors can lead to symptoms causing anxiety, symptoms causing depression, and it's changing those viewpoints that will help the anxiety, depression, and so forth. So it's important to not dwell on any negative thoughts. And if there are instances when it's too difficult to change the way one is thinking about the situation, then that's where medications can be important, because medications can help to calm down the mind so that you have more control over those thoughts. And by controlling and addressing those thoughts, then the feelings and actions can follow. So what Christianity teaches us is that the point of attack that the devil may aim to attack humans by is these thoughts. It's this mindset, especially trying to change it to something that's dark, evil, or something that will pull somebody away from the goodness and holiness of God. So we see this example in Jesus' life. Shortly after he was baptized, he fasted for 40 days when he was going to start his ministry, and the devil multiple times tried to tempt him away from his spiritual life. Christ made sure to not give any validity to these attempts of the devil to try and persuade him, even when the devil was trying to quote scripture himself into getting Jesus to do something wrong. St. Paul, in his second epistle to the Corinthians, also warns the community of Corinth about this, stating to them that casting down arguments and every high thing that exalts itself against the knowledge of God, bringing every thought into captivity to the obedience of Christ. So part of both mental health and spiritual health is being vigilant or attentive of what one is thinking, what one is feeling, one's actions. And so thoughts are just thoughts. They may not have much truth to them. They may have a lot of truth. So as a psychiatrist, a lot of the focus of my treatment is going to be on gauging how one is thinking. Are their thoughts difficult to control? Are they focusing on the negative and minimizing the positive in their life? All this can be important to assess to see what types of medications or therapy that the patient may benefit from. In fact, there's a mental health movement that just focuses on making the thoughts and attitudes positive, and it's called positive psychology. And it's something the Bible has been teaching or trying to address for thousands of years. In the Old Testament, in the book of Proverbs, King Solomon says, "Anxiety in the heart of man causes depression, but a good word makes it glad." He also states that happy is the man who is always reverent, but he who hardens his heart falls into calamity. Thousands of years ago, the wise people have been trying to show us to focus on the good parts of life, to respect others, to have a humbling respect for God, and this leads to gladness and happiness. St. Paul also adds in his letters to the Philippians when he says, "Rejoice in the Lord always." And he also says, "Finally, brethren, whatever things are true, whatever things are noble, whatever things are just, whatever things are pure, whatever things are lovely, whatever things are of good report, if there's any virtue and if there's anything praiseworthy, meditate on these things." And whenever we focus, give attention, or concentrate on certain thoughts, they tend to grow. Then maybe it's important to focus on good, lovely, uplifting, and encouraging thoughts. One needs to fill their 5 senses, the vision, hearing, taste, touch, smell, with parts of life that are good, and it'll help with both spiritual and psychological health.